Welcome from James and Radhika at Yoga Plus Therapies on this short class for foot and ankle well-being and health. This is a good class if you do have a little bit of aches and pains with your feet, but we recommend that if you do have a problem with your feet, that you always seek advice from a physiotherapist or health professional first to make sure that any practices you do are appropriate for yourself. Not all of the things that we do in this class may be suitable for you. So take care, do it gently, and stop if anything causes you discomfort or stress or strain. We're going to begin with building some awareness of our feet and going through some basic practices, and then we'll come up to standing to show you how to better make use of your feet when you're doing some of the classical yoga standing practices. So we're going to start first with Radhika just extending her legs out. She'll just have them slightly to the side so you can see what is happening. Now, Radhika's going to place a block between her thighs. And the reason for this, and if you have a block you can do this yourself, it's just we want to do the movements from the feet and the ankles rather than have too much action from the hips. So you want to keep the knees and the hips reasonably steady before we do these practices. So the first thing I'm going to get ready to do is just point and flex the feet. So you can do this yourself. Just point and flex the feet. Notice how it feels. Check your range of motion. As you point down, you're using muscles on the back of the leg, the calf muscles. As you draw the feet up, you're using the muscles on the front of the legs to draw the feet upward. This movement comes from the ankles. And the ankles are hinge joints, so that's all it can do. It can just basically do this up and down action. Now we're going to do the inward and outward movement. So if we do the inward movement, this is called inversion, and then we do the outward movement, and this is called eversion. So just repeat that a few times. Now this movement is occurring within the foot. So it's occurring below the ankle, and we're using muscles to do that action. And they're very important muscles that we make use of when you are doing standing practices. So as you go inward, you're using the tibialis muscles, the tibialis anterior posterior, to help bring that foot inward. And when you move outward, you're tending to use the perineal muscles, the ones on the outside of your legs, to help do that action. So just be mindful and just see if you can feel those muscles working as you do those two actions. Remember, we're just moving the feet. We're not moving the hips or the knees. You'll notice also when you draw the foot inwards, it points slightly down. And when you draw the foot outwards, it points slightly up. Okay, so these are just the basic moves around the ankle and the upper foot. Now we're going to go into a few simple moves of the feet and the toes. So Radhika will remove the block. Probably best to do this 1 foot at a time. So just bring one leg bent up, foot flat. Feel that you're even through the heel and the ball foot. And we'll just do some toe movements. So just lift all the toes up. Feel them stretching away from the floor. Now push all the toes down to the floor, but don't curl them under. Just keep them nice and straight. Just do that a couple of times. You feel that movement of the toes. Good. Now draw all the toes up and just the big toe, push it down. As you push it down, make sure it doesn't curl out towards your other toes. You want to try to make it push down and go in towards your other leg. So it's going towards midline, not away from midline. Now, what we're trying to do with this action, just relax for a moment, is to get the inner toe adductor muscle working. Radhika just turns the foot, or can demonstrate with the other foot side, on the inside edge of a foot. There's the muscle, so just on the inside there, that's it. It's just in there. That's where you feel the toe adductor muscle working. So that's where you want to feel the action, when you're pressing that toe down and slightly inward. So do that a couple more times with that leg, the one you were doing before. Just the big toe, so you're feeling that inner work. This is a helpful practice for those people who have maybe the bunion, the problem where you've got that arthritis in the big toe. You can lose the strength of that muscle. Now, also, just try this now with the little toe, just the little toe. So lift all toes up and just the little toe down. In the same way, you should be able to have nice control of that little toe. And if you're very good, you should be able to do little toe and big toe together and keep the other toes up. Takes a bit of concentration and coordination. Excellent. The last action to do with the foot is the foot lock or foot bunda. Now with this practice, you lift all the toes up, lower them down without them curling, press the tips slightly to the floor and draw the front foot towards your heel foot. And feel that the arch increases a little. And you'll feel the firmness come into the foot. Try to do it though, don't let those toes curl under. Got to keep the toes very long. You've got to keep the whole ball foot and heel foot flat. There's no rotation inward or outward. And it can be hard work for some people if you're not used to this action. So when you start, just do a few, otherwise you may find you get some foot cramping. Okay, let's do the other side. So do the toes up and down. You've sort of woken them up by doing the first side, so you should know what to do. The toes up, the big toe down. Make sure as it goes down that you're trying to draw it in towards the midline and work those inner muscles on the inside and edge of the foot, the adductor muscle. Okay, the little toe. Or big toe and little toe together, keep the other toes up. So developing that good fine control of the toes, the feet. And also the foot lock. So stretch all the toes up, lower them down, don't let them curl, press slightly to the floor and draw the ball foot to wheel the heel towards the heel foot to lift the arch. You can see Radhika's arch, just agilely lifting up slightly. Make sure you keep the foot flat though, there's no inward or outward movement. Good. Now one of the things just to note too with the foot in this position is if you flex the toes up, notice how that also brings the arch up. So what you're doing when you flex the toes like that is you're stretching what's called the plantar fascia, the big connective tissue structure in the sole of the foot going from heel towards the toes. So this is a structure that causes a lot of grief for many people, and it often happens because the toe muscles have become very weak, or the foot muscles have become weak. And so we overload it. We have to use that structure to try to maintain the arch in the foot too much. Now, from here, what we're going to do is do a little bit of foot massage as well. Foot massage is very good for foot health. So we'll go through some key points that you can practice. I'll also show you how to use the tennis ball for foot massage as well. Now, the first point we're going to do is just going to bring the leg up so Radhika can demonstrate the points. So we're going to do 3 points on the foot and one point or 2 points around the ankle and the calf. So the first point we're going to do is between the big toe and the second toe in the web. And it's about a thumb width up from the end of the web. It's between the bones, and you can press it from the thumbs, from the bottom or the top. It may be a little tender, and we do circle massage. These are energy points, so you don't have to press hard. We just do circular massage to wake it up. It should feel really nice. You can do it up to 21 times. Now, the second point, if you divide your arch into 3, there's a point in the arch of the foot about 1/3 back from the ball foot area. So explore around until you find a little depression. Once you've found the depression, it may be a bit tender, and it may not be exactly where Radhika's doing it, because we all have it in a slightly different spot. You just got to play around to find the right point. Often it feels a bit tender. And then you do the circle massage again. The third point on the foot is more towards the heel, still in the arch of the foot, but back more towards the heel, but in front of the heel, maybe a bit further forward. That's about, and there'll be a little hollow, maybe tender, and the same thing you can do massage in this point. So these energetically help your feet and your body. That can be very grounding and soothing if you're feeling a bit agitated as well. Foot massage is a really important part of the Indian traditions of both yoga and Ayurveda, the health medicine. Now, the ankle itself, Radhika's going to just put a foot down on the floor, and you can massage the ankle with both hands on either side of the bones. And you just basically circle around. Sometimes you can circle around the front of the ankle too, but it just depends what feels right. The whole ankle in the Indian tradition is a big energy point. Now the final point is the calf one. So if you find the Achilles tendon and track the Achilles tendon from the heel up until where you feel the muscles separate on either side, there's a little hollow. And that's the place where you can massage as well. So this is a nice one to release the calf, the ankle. Helpful for cramping sometimes. Circle massage is especially helpful on this one. Good. So just note how that foot and side feels from doing the massage, and just notice if it feels different to the other side, more alive. So let's balance it out. Let's do the second side. 3 foot points in the web. The one in the middle of the arch. Again, experiment. It may be slightly further back to the heel for some people. It's right where the hollow or tender point is. This is a really good point to ground your energy if you're agitated. And the one towards the heel is really good for the soft tissues of your body. Massaging the whole ankle. Circle massage again is really nice around the bones or at the front. And the calf. Track up the Achilles to where the muscles separate in the hollow and give it a circle massage. You can use thumbs or fingers, what works best. Careful not to strain your finger joints, and remember you don't have to push hard, it's energy. You're not trying to do deep tissue massage. Needs to be comfortable. Hopefully that leg now feels balanced as well. So let's just take a couple of breaths. A nice simple strengthening practice for the outside of the legs and the outer feet is to sit in a cross-seated posture. If you find this awkward, then sit yourself up on cushions or blankets to make yourself a bit higher. Feet out to the front a little bit. And be really mindful when you do this practice not to twist or create any stress or strain on the knees. What you want to do is draw the feet slightly up so that the feet are in a neutral position, and then press the outside edges of the feet into the floor. Make sure it's flat from heel towards the toe, so the side foot, the knife edge of the foot, is pressing into the floor, and you feel the work through the outside of the legs. So this is first position. As you get stronger, and if you have no troubles with your shoulders and wrists, you can also use the pressing through the sides of the feet, the hands by the sides, and lift yourself up using the strength of the legs as well as a little bit in the arms. Watch that you don't hunch when you do this practice. But feel that work through the outside of the feet, working to create good control and strength. This is a good practice as a precursor to going into the plank posture, the side plank posture, which really works the side edges of the feet. Radhika will just briefly show you the side plank, but we won't go into too much time with this particular series of practice, but just so that you're aware of it. So a straight line from shoulder, forearm, make sure there's no hunching, drawing the tummy muscles, and lift the waist and pelvis up from the floor and press the outside edge of the bottom foot into the floor, just like you were doing when you were doing that seated practice. If your balance is poor, you can have one foot to behind to help stabilize. Take it the other way. Yeah, so it's best on the one behind. And so you can press that outside edge of the foot. And it's a really good way to strengthen the foot. So this is especially helpful if you've had injuries to the ankle, to the outside ankle area. Okay, so that's just something to be mindful of. Okay, so let's come around to hands and knees position, into tabletop. Knees under hips, hands just forward as shoulders. And just before we do the footwork here, let's just loosen up the back of the hips a little bit by doing a few cats. So exhaling into the tuck, inhaling into the gentle extension. And as you do this action, be very mindful of the pelvis and the tailbone. The reason for this is the posture of the pelvis as well as the posture in the hips can have a big influence on your feet and ankles. And we'll go through this when you're standing, but it's nice to be aware of those areas. And we always want to try to aim towards a neutral spine with the slight tail out when we're in the standing practices, unless otherwise indicated. Okay, now we're going to do a simple stretch of the calf muscle. We're just going to stretch one leg back, the ball foot's on the floor, heel is up, straight up, not to the sides. And using the hands, Radhika's just going to shift the body weight back so that the heel goes behind the foot, and you feel the stretch coming into the calf, and then she'll hold the stretch, feeling the stretch in the calf area. This can be done in two ways, with a straight knee and a slightly bent knee, and you can get different sensations of stretch between the two. Just nice to release it. Okay, let's slowly swap sides. So just draw the knee to chest, do a little tuck, drop it down and try the second side. Ball foot to floor, heel is up, aligned. Shift the weight back until you get the stretch into the calf area. Again, see how it varies between straight knee or bent knee. Find a nice place and hold. Hold, release. Use your breathing, smooth and even. Spine is just with that neutral curve with slight tail out. Good. Now the second stretch we can do from here is Radhika's going to just tuck her toes under. So tuck the toes right under. Make sure the heels are up and everything's aligned, even through all the toes. And then just going to see if she can sit back onto her haunches like for a warrior or hero sit. For some people this is very strong and they can't always do it. You could try a roll, but remember if you've got really tight feet this may be too much. But it is a nice way to stretch out the structures of the sole of the foot, including that plantar fascia area. Just got to be careful it's not too much of a stress on the big toes if you have problems there. And wait sure you're not twisting the knees in any way. Okay, so ease the feet out. Take a little stretch back into child stretch for a sec, just to loosen the back. Notice in child stretch how it stretches the front of the feet and the ankles. And another thing to be mindful here is that where the feet are facing. Often when we do this, we let the feet turn in the inversion. But try to have the feet more in the neutral or even slightly eversion position and just see how it alters the stretch through the front of the ankles and the tops of the feet. Spread the toes. Good, let's slowly come back up to the tabletop, hands and knees. And then we're going to make a transition up to stand and do some of the standing awarenesses and practices. So let's come up slowly to stand. We're going to come into mountain posture. Feet a little bit apart. We'll make it easy mountain. And just be a little bit aware of your feet to begin with. How is the weight sitting through your feet? The heels, the ball feet, the toes, the inside and the outside of the feet. The feet are designed to have arches. There's arches from front to back and side to side, but sometimes we can lose that. The feet can flatten, and some people can have exaggerated arches. So I'm going to show you how to use your body the right way to best help the feet and the ankles. Now, the first thing I want you to do is just be mindful of how posture can affect the feet. So I want you just to move your pelvises forward towards your toes a little bit. It's like you're in a bit of a sway back position. And notice what happens when you do that to your arches. Radhika is really exaggerating it, but some people do tend to, lean the pelvises forward a little bit. Just do a subtle one, right? Just so people are aware of just the subtle, how we can do that as a postural thing. And sometimes you can just notice how the arches may be actually stressed more. It's harder to keep them up when you're in that position. So if you bring the pelvises now back in line with the ankles, with the tail in its natural out position and natural curve, just notice how the feet work in this position. You'll find when the spine's more neutral with the tail out, not only is it better for your spine, but it's also better for getting your feet muscles to work naturally. So always remember good posture for feet as well as the rest of the body. Now the other thing to be mindful of in standing is how we use our hips. Now if Radhika just lets her knees turn inwards, notice what happens to the feet. So if you do the same thing, if the knees turn in, the feet turn in, and you collapse the arches. If Radhika does the opposite and turns the knees out, it turns the feet outward, and we get too much weight on the outside edges of the feet. So remember, it's not better to have more on the outside or inside. Where you've got to do is have the weight so it's evenly distributed, so there's no stresses in any one spot. That's what causes strain, is because we stress one area too much. So alignment's important. So you want to have the knees aligning to the feet in whatever practice you're doing, because remember, the ankle is a hinge, so it only goes forward and back. It doesn't go in and out. So if you're off a line, then you're putting stress to the feet. Okay, so this will come relevant when we do the heroes especially, and the triangle posture. But the last thing here in the feet to be mindful of is when you come up and down on the toes. I'm just going to get you to come up onto the toes now. And sometimes what happens when people do this is they roll the toes out, or they roll the ankles outward. So if Radhika comes up and deliberately rolls her ankles outward, notice how the weight goes to the outside of the toes, and it's not very stable. So come back down. So we want to come up and down with more weight through the big toes, and the ankles are more towards each other, not rolling apart. When you do this action of pressing the big toe ball into the floor, you make the muscles on the outside of the legs work, the perineal everter muscles to work, and that helps to stabilize and strengthen your ankles. Especially helpful if you have had an ankle injury. One thing I'll get Radhika to just demonstrate is if you have had an injury and you're very weak, it may be too much to do this in a standing way, and you can do it using a band. So Radhika will just come down on the ground, just show you how you can use a band to do the same action to strengthen if you are particularly weak. So you get a TheraBand and place it around the ball foot.
This one?
Yeah. Make sure it's around the ball foot, not the toes. Keep the toes free. It's not in the arch, it's above the arch. So it's right on the tops of what we call the metatarsals, the heads of the metatarsals. Take up a bit of tension so there's no strain on your back or shoulders. And then Radhika's just going to practice that pushing down. And as you push down leading with the big toe side. And you can feel the work as well. That won't be just in the calf, but also the muscle on the outside of the leg. The everter will be working to keep that good stability and control. So it's just something to be mindful of if you do have very weak ankles, that you can do this before you even start doing the standing practices. Okay, very good. So let's come up now. We'll go through some more of the standing practices. So one of the common standing practices we do is the warrior series. So I'm going to get Radhika to come into the warrior number 1, Virabhadrasana 1. We're going to do this with foot awareness. So to start with, let's do a smaller practice than normal. So we're not going to step the leg backward as far as perhaps you might be used to. So just take a 2/3 of the way step back. Toes, heel is grounded. Slightly turned out. The more the toes face forward on the back leg, the more you're going to feel the stretch in the calf. The front knee is bent over the ankle, so we have good alignment. The back knee is slightly turned out, so it's in line with the foot. So remember we talked about that alignment of knees to foot. The pelvis is more or less forward with the natural tail out action. Lower back natural arch. Now we're going to do a strategy on the back foot to help strengthen the foot and arch and protect it in the standing practices. So what I want you to do is push the outside edge of your foot into the floor first. So we're working the foot inverters first, tibialis muscles. Now, keeping that pressure on the outside edge, just push the big toe ball into the floor. So we're getting what we call co-contraction between the two groups of muscles. And you'll feel that the foot and arch becomes nice and strong and stable. When you do these actions, they're not maximal actions. You know, you just press enough to feel and awaken the muscles, but don't try to do it too hard, because otherwise you're just going to strain and hurt. So it's a really good way of getting those back foot muscles working. Now with the front foot, you can do something similar, but you can also use the foot lock action too. So if you lift the toes up, feel the arch lift slightly, lower the toes down, and draw the forefoot towards the heel foot slightly until you feel the arch engaging. Remember, good alignment. And you can do that action even without using the toes that much. So remember, don't try to do maximal action. It's just a light activation to feel the foot muscles alive. Very good. Let's do this other way around. So waking up those feet. So outside edge presses into the floor, then the big toe on the inside until you get the co-contraction between the two groups of muscles. The foot and arch are alive. The front foot muscles are alive, awakened with the good alignment. Feel the nice strength through the lower with the upper body relaxed and spacious. Okay, very good. This same action you can apply to triangle posture. So try that as well. So take the feet apart. Turn the right toes out, 90. Adjust the back here slightly. And in the same way, awaken those feet. So the back foot outside edge, the big toe ball. So you've got that co-activation. Knees aligning. Awaken that front foot, especially the big toe. You can really, the big toe on triangle works really well. You can do that toe adductor action on the big toe there, and that can work really nicely in triangle posture. And then just come into the side move from the pelvis. Remember, keep natural curves. Tail slightly out. Doesn't matter if you don't go very far over. It's not about hitting the ground, remember. It's where your pelvis and hips allow you to go in triangle posture. Feel the liveliness of the feet. Okay, coming up and try the second side. Outside edge, big toe, ball, activate the foot. Live in the front arch, knees off lock, and remember the alignment. Tail out, natural back curve. Find the breath as well. So all the yoga principles apply. Excellent. Coming up, come back to mountain for a moment. And just notice, how do the feet feel from doing those actions? Now the other aspect of ankles and feet health is the strength and your balance work. So we can do strength work in some of the arm balance positions, but the balance work itself is really nice to do from the standing position. Now with balance work, what we're trying to do is improve the speed of the reflexes. We're trying to make those muscles react all around the feet and ankles to hold you upright and steady and get them working. So the way to achieve balance is we've got to make challenge to those muscle systems. So it's always important to do balances safely. So obviously if your balance is not good, always practice close to a wall or somewhere where you can hold on if necessary. But Radhika will just demonstrate on the mat position. So let the knees soften. Just take one foot in front of the other foot in what we call the tightrope position. And just notice as you do that action, keep the knees a little bit soft, a bit bent. Just notice how they're reacting to hold your balance. Those feet are working. This is one of the simplest ways to work the balance. Try it with the other way around as well. You can be surprised how one side works different to the other. Maybe not as steady. Okay, then come back to the mountain position. So you can also challenge the balance more by taking one foot completely off the ground, which is common in the yoga balances. So Radhika's just going to come into tree posture. The tree posture can be below the knee or above the knee, not on the knee. Keep the stance knee soft. Practicing the balance. When the arms go up, it's more challenging because it's sort of taking your center of gravity up. You can challenge the balance by having the eyes a little bit closed, but only do this if it's safe. And you can also challenge the balance by balancing on something that has more give, more softness. So, Radhika, come back down. Just get her to roll the mat up a little bit. So, make the mat into 4. So more rubber, thicker. You could do this on a cushion or a foam, or ultimately you could invest in buying a special balance cushion, which really creates wobbliness. Try the other side. Just notice when there's more give, you have to work harder to keep your balance when there's a more soft surface. So these are different ways that you can challenge those balance reactions and get them to work more. Very good. So, when you're ready, just take a short pause again and notice how your feet feel. And I mentioned before that if you don't want to do foot massage, you can also do massage with a tennis ball. And you can do this from either sitting in a chair or standing. If you're standing, you might want to hold onto a wall. But you can just roll the tennis ball over your foot arch or side to side. So that can give it a nice stimulation. Or if you've got really tight toe tendons on the top of the feet, if you move the tennis ball towards the ball foot and try to stretch the toes right round the ball. Trying to stretch across the top of the toes. And get the arch back into the front of the foot there. So that can be another strategy you can use just to help restore that. So arch massage or toe stretching. Good. So we're going to come back down now for relaxation. Now, elevation can be really nice for the feet and ankles. So it might be fun, you might find it really helpful to do your relaxation practice with your legs raised up onto a chair. If you find that the chair height's just not quite right for you, you can get a blanket and place it underneath your pelvis, and that might give you better positioning. So Radhika needs to just move her blanket down a bit lower and move herself a bit closer into the chair so her legs are well supported by the chair. So you want to feel well supported and rested, so you feel like you can just relax. Just let all the tension drop out of the body. The hands can be just by the sides. Make sure you're even weight through the pelvises and the legs. And just let relaxation come upon you. The softness in your toes, the tops of the feet, the soles relaxing. Relaxation around the ankles, the front of the legs, and the calves, all releasing. Softness through the knees, the thighs, and around the pelvises. Feel the back soften. Feel the upper back resting, the shoulders released, the head supported and relaxed. The easy breathing in and out. Natural breath. Now, we'll just do a simple healing practice to conclude. Just imagine there's a coloured energy at your navel. See the colour that's healing for you today. As you inhale, feel that healing colour expanding. Feel the growth of that healing colour, the positive energies growing. And we're going to send that healing energy down your legs, down to the ankles and the feet. I want you to imagine as though your feet were immersed in that positive healing energy. Giving it any sensation you feel makes your feet and legs feel better. Feel the healing quality, taking away any discomfort. Feeling the cells pulsing with positive energy. Feeling the wellness returning to your feet and ankles. Now, you may feel like you want to stay there longer. Feel free to do so. Otherwise, if you're ready to come back from relaxation, just gently bring the knees into the chest. Give them a light hug. And you make sure you roll to one side and pause for a moment before you come up. Because you've had your feet up and head down, so it can have an effect on the blood pressure. So don't be in a rush to come up to sit. When you're ready, just slowly coming up. Take a moment, note how your feet and ankles feel now. Bring the hands together. Namaste. Thanks again for sharing this foot and health well-being for ankles and feet from James and Radhika at Yoga Plus Therapies.